what I loved, and the reason I'm doing it in the first place is to feel like I'm equipped to be able to actually use this information to help pets and help people, because I've just had this sense, I mean, in human medicine, but also with veterinary medicine, that there's this huge gap between what vets in the clinic do well, which, I mean, they're so important. I mean, I've certainly had pets where they have an acute issue or an emergency issue, and without the vet, you wouldn't have your pet anymore to help with those situations. But in terms of chronic things or preventive things, or just recognizing how much benefit there is from tending to things like nutrition or some supplementary things, I feel like this missing gap in terms of what pet parents can do and how we can improve animals' health. And so to be able to have the information and the support to actually do that just feels good. I mean, there's so much in life where you feel like you see a problem, but you can't really truly make it better. And this is one of these things where it's so fulfilling, because I feel like we're learning this really interesting information, but it's an opportunity to truly step in and actually make a difference. I mean, it's one pet at a time, but I just love that feeling. And I also just think it's interesting. I mean, I'm a sciences, health related person, and I just think how the body works and, how it's made in this intricate way with all these interconnections is fascinating. So just learning about that is wonderful. And Dr. Roberts is a gem. I don't need to tell you that. You've worked with her all these years, but I mean, her commitment and her heart for this and her experience and just her obvious intuition. I mean, she just has this kind of sense about how to follow a path of where a health issue with a pet is going and help us bring the learning content into the context of a real life example. It's just a fantastic way to learn. It really makes the information come alive.